More than 30 million Americans live with diabetes, and the disease is one of the leading causes of death in the 21st century. There's much to be understood about diabetes, all the factors that contribute to it, where those factors come from, and how they affect us.
Diabetes is a very common disease. It affects about 30 million people in the United States, and globally, almost 800 million people have diabetes. There are actually two kinds of diabetes, type 1 and type 2 diabetes. Type 1 diabetes, oftentimes known as juvenile onset diabetes, represents about 5% of diabetes, and type 2 diabetes represents 95% of diabetes. So when we speak of diabetes and the global burden of diabetes, we're really thinking mainly about type 2 diabetes, but not exclusively.
Diabetes affects many different organs and many different cells. We are actually learning more and more about how intricate this network of events in the body is. I think that some of these intricacies have really only become known in the last decade.
When we have overnutrition, then your pancreas has to make more insulin because the tissues in the body become insulin resistant. So if you have a situation where you need to make more insulin on the one hand, but your pancreas can't keep up, eventually what happens is a scenario where your blood sugar levels begin to rise. And that basically is what happens in type 2 diabetes.
Scientists around the world are working hard to further understand the disease and reverse it.
When you think of diabetes, you may not think of skeletal muscle, but we're interested in understanding how muscle regulates its size and how it's influenced by conditions such as diabetes, which can result in a loss of skeletal muscle mass and therefore a loss of tissue that can take up glucose.
So the particular aspect we're interested in is why patients with diabetes do worse after balloon angioplasty, and also to some extent why do they have more and bigger atherosclerotic plaques. What we're trying to do is we're trying to understand parts of a cell, which are called mitochondria. They make the energy inside the cell, whether they can be protected from the overload of nutrients that you see in diabetes. And whether doing this keeps the cells from growing so aggressively.
There are people who are interested in the pathophysiology of feeding and energy expenditure because those two areas clearly impact one of the biggest risk factors for type 2 diabetes, which is obesity.
So there are a number of different approaches to go about this. One of them is to address the other conventional risk factors of diabetes more aggressively, so to lower the lipids, for example, more aggressively in diabetics and in non-diabetics.
Another project that we're involved in is called MotorPack, which stands for Molecular Transducers of Physical Activity. MotorPack is to try to understand the molecular mechanisms underlying the health benefits of exercise.
As part of University of Iowa Healthcare, the Fraternal Order of Eagles Diabetes Research Center is a world-class leader in the quest to understand and treat diabetes. From studying lifestyle habits to muscle atrophy, Iowa's Diabetes Research Center is scrutinizing every aspect of the disease. The goal? Reverse diabetes.
I think there are a number of unique aspects of the research here. With over 100 independent research programs, we're one of the largest diabetes research programs in the world. We aren't just focused on one particular pathway, but as I described earlier, we're really focusing on multiple pathways that might be involved in diabetes. And finally, some of our scientists have developed very sophisticated tools to measure brain pathways that regulate metabolism and feeding behavior. If we're going to advance our understanding with the goal ultimately to either cure or prevent it, then we believe we have to take a multi-pronged approach. I would say that the Fraternal Order of Eagles Diabetes Research Center is an amazing example of human generosity. Probably about a decade ago, a faculty member here at the University of Iowa, John Stokes, began to get small grants from the Eagles to do his research, which was actually involved in understanding the way that diabetes affects the kidney. And so he went to find out, and he met some Eagles. So he got talking with them and said, you know what? There are nearly 1 million Eagles across the United States, and you're all working very hard to make a difference in the lives of many people. Wouldn't it be really cool if you could actually focus on one thing that you could make a big difference? And so over the course of 6 years, they really went in all hands on deck to raise $25 million as a gift to work towards creating a diabetes research center that bore their name.
Hundreds of thousands of individual donors within the Fraternal Order of Eagles are paving the way for transformative research. This research changes lives for those living with diabetes and its complications. Through ongoing clinical trials and groundbreaking investigations, reversing diabetes will one day be a reality.
Currently, there are no therapeutics to treat muscle atrophy, and muscle atrophy is a major consequence of a number of diseases such as diabetes. In the last 10 to 20 years, we've made significant progress in understanding some of the mechanisms that are responsible for muscle loss. Hopefully this knowledge will lead to drugs that can prevent muscle atrophy, slow its progression, and or help the recovery of muscle mass following an atrophy-inducing event.
I have a particular angle on diabetes as a cardiologist. There are many aspects which may be outside of the world of cardiology and blood vessel and heart disease, which may impact diabetes care and outcomes in diabetic patients with heart disease. So, for example, protecting the kidneys or changing the abnormalities in metabolism in the liver.
The future of diabetes is how do we then take all of this scientific data, how do we then begin to apply it to the patient that I might see across my table in the clinic, so that I can then tailor an approach to that person to ultimately optimize the likelihood that they'll get the full benefit from whatever we prescribe. There's a lot that needs to be done in terms of how can we get people to be adopting healthier lifestyles, healthier diets, more activity. There are big questions around that, which we believe will also have a big impact ultimately on preventing diabetes in the first place.
To learn more, contact us today.